Axicabtagene ciloleucel, also known as Yescarta IV suspension, is used in the treatment of a specific type of cancer called non-Hodgkin lymphoma. This treatment falls under the category of gene therapy, where the medication is made from your own white blood cells and is administered solely to you. These modified white blood cells contain a specific protein called chimeric antigen receptor-CAR, which aids in slowing down or halting the growth of certain cancer cells in your body. It is important to follow the recommended daily dosage and take this medication at the optimal timing as advised by your healthcare provider. Before starting to use Yescarta IV suspension, make sure to read the medication guide provided by your healthcare professional. If you have any questions, don't hesitate to ask them. Your doctor may recommend 3 days of chemotherapy before starting treatment with Yescarta IV suspension to prepare your body. This medication is given by slow injection into a vein as directed by your doctor, usually over less than 30 minutes. Your doctor may also give you other medications, such as acetaminophen or diphenhydramine, to decrease the risk of side effects before injecting Yescarta IV suspension. The dosage is based on your medical condition and weight. It's important to plan to stay for at least 4 weeks near the place of your treatment, for example, within a 2-hour drive. Your doctor will check to see if the treatment is working and help you manage any side effects. If you are taking Yescarta IV suspension, you may experience side effects such as headache, tiredness, or loss of appetite. It's important to let your doctor know if these effects persist or worsen. While this medication can have serious side effects, it is prescribed to you because the benefit outweighs the risk. Your doctor will monitor you closely to decrease your risk. Yescarta IV suspension is used to treat cancer, but it may also increase your risk of developing other cancers. Additionally, it can cause a severe decrease in your blood cells, making it harder for your body to fight infections and increasing the risk of anemia/bleeding problems. Be on the lookout for unusual growths or lumps, swollen glands, signs of infection, easy or unusual bruising/bleeding, or unusual tiredness, and inform your doctor right away if you notice any of these symptoms. While allergic reactions to this drug are rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you have concerns about the side effects of Yescarta IV suspension, don't hesitate to reach out to your doctor for guidance. If you're considering Yescarta for suspension, there are some important things to keep in mind. This medication can cause a serious reaction called cytokine release syndrome, CRS, which can be fatal. It's important to be closely monitored and seek treatment promptly to reduce the risk. Before starting treatment, make sure to inform your doctor of your medical history, especially if you have had any recent infections. Be on the lookout for symptoms of CRS such as high fever, difficulty breathing, chills, severe nausea, vomiting, diarrhea, muscle or joint pain, low blood pressure, dizziness, or lightheadedness. Additionally, serious nerve problems can occur after treatment with Yescarta. If you experience trouble speaking or understanding, loss of balance, seizures, anxiety, confusion, or memory loss, it's important to contact your doctor immediately. In the United States, it is necessary to understand, agree to, and follow the requirements of the Yescarta and Tecartus REMS program in order to receive this medication. If you live in Canada or another country, it's important to consult your doctor and pharmacist for your country's regulations. Remember to follow your doctor's instructions carefully and discuss any concerns or questions you may have about Yescarta for suspension. Before starting Yescarta IV suspension, it's important to inform your doctor if you have any allergies or a history of past or current infections. This medication can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has a contagious illness. Additionally, you should let your healthcare professional know if you are planning to have any immunizations or vaccinations, as well as if you are pregnant or breastfeeding. Yescarta IV suspension may also affect your coordination and ability to think clearly, so it's important to avoid activities that require alertness and limit alcohol consumption. If you have any upcoming surgery, be sure to inform your doctor about all the medications you are taking. When taking Yescarta IV suspension, it's important to be aware of potential drug interactions. These interactions can affect how Yescarta IV suspension works or increase the risk of experiencing serious side effects. It's important to maintain a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. This will help them to ensure that there are no potential interactions with Yescarta IV suspension. It's also crucial to never start, stop, or change the dosage of any medicines without first consulting with your doctor. This will help to ensure the safe and effective use of Yescarta IV suspension. If someone has taken too much Yescarta IV suspension and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, residents can call their provincial Poison Control Center for assistance. Before receiving Yescarta for suspension, your doctor may perform lab and/or medical tests, such as complete blood counts, to ensure it is safe for you to receive this product. It is important to keep all medical and lab appointments before and after receiving this treatment. After receiving Yescarta for suspension, it is important not to donate blood, organs, tissues, or cells. This is to prevent the potential transfer of the medication to another person. If you miss a dose of Yescarta, contact your doctor immediately to determine the next dosing schedule. This medication is given in a hospital or clinic and should not be stored at home. It is used to treat certain types of non-Hodgkin lymphoma in adults. The dosage will be determined by the healthcare provider and will be administered by a healthcare professional. It is important to follow the instructions given by the healthcare provider for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.